He has very good abduction, wide abduction. We improve things with this. We have to worry about
This is their first language. कोई problem हुआ किसी को?
2083 साल वैशाख 6 गतेदेखि 2083 साल वैशाख 10 गतेसम्म हामीले हिलिङ द चिल्ड्रेन युएसए मिसन मार्फत फुट एन्ड एङ्कलको टिम जुन अमेरिकाबाट यहाँसम्म आउनुभएको छ, जसलाई डाक्टर अली रेजा खुसरोवादीले लिड गर्नुभएको छ र उहाँको टिममा डाक्टर जोन हेजेनबर्ग र डाक्टर जेनिफर डी एमिको हुनुहुन्छ र यसमा 8 जना त्यो टिममा एचटिसी हिलिङ द चिल्ड्रेन युएसए एचटिसी युएसए को 8 जना टिम मेम्बर हुनुहुन्छ र उहाँहरूको सहकार्यमा हाम्रो नेपाल अर्थोपेडिक हस्पिटलबाट अर्थोपेडिक कन्सल्टेन्ट डाक्टर रचित शर्माले हाम्रो तर्फबाट यो फुट एन्ड एङ्कल सर्जरीको टिममा सामेल हुनुहुन्छ र यो जुन यो अहिले आजदेखि भइरहेको जुन सर्जिकल फुट एन्ड एङ्कल सर्जिकल क्याम्प छ, जुन यस नेपाल अर्थोपेडिक हस्पिटलमा भइरहेको छ, यो हिलिङ द चिल्ड्रेन युएसए मिसनले अनवरत रूपमा 15 वर्षदेखि यो सेवामा सहभागी भइरहेको छ। त्यसकारण हामी हिलिङ द चिल्ड्रेन युएसए स्पेसल्ली फुट एन्ड एङ्कल टिमलाई धन्यवाद दिन चाहन्छौँ र उहाँहरू यो विशुद्ध निशुल्क सर्जिकल क्याम्प हो। यसमा बच्चाहरूको विभिन्न किसिमको समस्याहरू, फुट एन्ड एङ्कलको र अरू पनि समस्याहरूको सर्जरी शल्यक्रिया गर्ने हाम्रो लक्ष्य रहेको छ। 2010 देखि चाहिँ जुन यो एचटिसी टिम युएसएबाट अनवरत रूपमा आइराख्नु भएको छ र प्रत्येक वर्ष यो भूकम्पको 1 वर्ष र कोरोनाको 3 वर्ष बाहेक अरू सबै प्रत्येक वर्ष उहाँहरू प्रत्येक वर्ष यहाँ चाहिँ यो क्याम्प लिएर आउनुहुन्छ र कम्तीमा 30 देखि 40 वटा निशुल्क विभिन्न किसिमको फुट एन्ड एङ्कलको सर्जरी गर्ने उहाँहरूले चाहिँ गरेर हामीलाई चाहिँ जे होस् यस अर्थोपेडिक अस्पताललाई सहयोग गर्नुभएको छ र स्पेसल्ली भन्ने भने नेपालकै बच्चाहरूलाई सहयोग गरिराख्नु भएको छ। अब यसमा सुरुमा एक वर्षदेखि नै हामीले ओपिडीमा आउने विभिन्न बच्चाहरू स्पेसल्ली बच्चाहरूको खुट्टाको हड्डी सम्बन्धी समस्याहरू हामीले हेर्दै गइराखेका हुन्छौँ र ती मध्येबाट जो नेपाली अर्थोपेडिक सर्जनहरू अथवा नेपाली अर्थोपेडिक सर्जनले चाहिँ यो फुट एन्ड एङ्कल टिम युएसएबाट आएको टिमलाई चाहिँ यो केस राख्नुपर्छ भनेर हामीले उहाँहरूलाई रिफर गर्छौँ र अनि त्यो केस जम्मा गरेर अब जस्तै हामीले जम्मा गर्दा लगभग 300-400 जना बच्चाहरू बिरामीहरू नै हामीले चाहिँ नाम लेखाएर राखेका हुन्छौँ र उहाँहरू आइसकेपछि त्यसबाट छानेर 30 देखि 50 वटा सर्जरीहरू गर्ने हाम्रो लक्ष्य हुनेछ र यो फुट एन्ड एङ्कल टिम जुन युएसए छ लगभग 15 वर्षदेखि अनवरत रूपमा नेपाललाई स्पेसल्ली नेपाललाई माया गरिरहेको छ र नेपाल अर्थोपेडिक हस्पिटललाई पनि एकदमै साथ सहयोग दिइरहेको छ। यो टिमलाई धेरै धेरै धन्यवाद दिन चाहन्छु।
Hello, Dr. Rosenberg.
Hey,
So,
Vinayak, how are you?
I'm good, thank you. So, how was your trip to Nepal?
I love coming to Nepal. This is my third time in the past 3 years, and it's become very quickly one of my favorite places to visit.
Okay, thank you for coming here. Healing the Children has done a lot for Nepal. So, could you mention how Healing the Children started and what your objectives were?
Right. So this group, Healing the Children, has been coming here to Nepal Orthopedic Hospital for 18 years. I've only been coming for 3, so I'm a relative newcomer. I'm also newly retired, but now I'm focusing on international service missions. So in the past 2.5 years, I've been to Nepal twice, Honduras twice, Ukraine once, and Israel 4 times, and Liberia once. So this is my bread and butter now. This is what I do. I don't operate in the United States. I operate only overseas, and I'm a grandfather also.
Thank you. Thank you for doing so much. So, what would be different this year than last year?
Well, what I'm finding is that every year that I come here, I see incremental improvements in the physical plant, in the organization. It's just getting better and better. And one reason why I chose to come back every year now to Nepal is because the local doctors here are very good to work with. They're very careful. They are very exact about documentation. And so when we came here, for example, for this trip, weeks beforehand, the doctors sent us x-rays, photographs, clinical histories of all the patients we were going to see. Maybe not all the patients, but most of the patients. That's something that in the other places I go, I don't always have that kind of cooperation and that kind of back and forth communication. We have a WhatsApp group between us and the doctors at the Nepal Orthopedic Hospital. And every time a patient comes back for a follow-up visit, in real time, I get a photograph, an x-ray, and I can type back what I think they should do, and we can discuss the cases. So there's a real relationship. It's not just that we go once a year, we operate, and then we go home. It's a continuous year-long relationship with the local staff here, and that's what I really like the most. It's very special. Not every place does that, but Nepal, the people are nice, the doctors are nice, they're very smart, they're skilled, and they want the best for their patients, and so they're very willing to take the extra time to go back and forth with us in the discussions, and with WhatsApp, we can do it in real time. So literally when the patient's in the clinic, they can take an x-ray and send it to me, and I can answer right away what my recommendations are. So it's great, a great relationship.
Thank you so much for your time, and
Thank you.
thank you for coming.
And then you press camera, and then you put the x-rays up there, and then you just take a picture.
Hello, Dr. Ali. How are you?
Good.
Today?
Good. Namaste. How are you?
Thank you for coming to Nepal. So we just wanted to know a bit about helping the children, how it evolved, how you guys have been evolving from years that you're coming to Nepal Orthopedic Hospital.
Okay. Yeah, so I've been involved for the past 11 years. My first year here was 2015. And I would say the camp has evolved nicely. We've been seeing more and more patients. We definitely wanted to concentrate on seeing pediatric patients, but over the years we have opened our doors to adult patients who come and they have multiple foot and ankle issues, or even upper extremities. So I've been fortunate to be able to bring my mentor, Dr. Herzenberg, for the past 3 years, and that added another dimension to our camp. So now we can do anything about the knee as well. So any kind of an upper extremity, knee, hip issues. So he's a great addition to our camp. At the same time, I think the hospital has evolved. The doctors and Nepalese orthopedic doctors who've been working with us have been great. One of the biggest accomplishments was this year. They screened a lot of patients prior to us coming here and got all the x-rays and clinical pictures ready, which made us to be more prepared to come this year. So I would say every year the camp is getting better. The hospital staff is providing a lot of additional help to us, and I feel like the facility has been more accommodating. The room has been nice and bigger and better AC system and all that stuff. So overall, it's been a great experience. I love coming here. I always tell everyone that Nepal is something that's been a big part of my life for the past 11 years, and I always look forward to come here and help the people in Nepal. And I love being here because the patients and the hospital staff, the doctors are very appreciative of us being here. So it feels good to come every year and be a part of this camp and give help. And also, I always say that we give and we also receive, because the big part of this camp, for me at least, I receive a lot of love and appreciation. The patients come back and thank us, and they bring us little gifts. So I go back with a lot of positive energy. So it's been a big accomplishment for me.
Could you tell me about healing the children a bit, and how I think treating children in Nepal is a bit different from treating children in your own practice
In the US.
all the way across the world?
So a little bit about healing the children. Our mission started here at this hospital in 2008. Dr. O'Neill, the founding medical director, and Dr. Stephen Miller out of Anacortes, Washington, happened to meet at a Rotarian meeting. You know, Dr. O'Neill was trying to get donations for the hospital, and that sent us into almost 20 years of almost continuous mission trips, aside from a couple things. In fact, we were here 2 weeks before the earthquake in 2015, treated a lot of patients. A very small team that I led in 2016 came, and a lot of post-earthquake trauma started. But the Healing the Children mission has always been to treat the children with congenital deformities, road traffic accidents, and adults who have congenital deformities. The biggest thing that we've always seen here, and the biggest difference, is that there's a lot of deformities that we treat as babies that get diagnosed with ultrasound, so we are prepared. And a lot of times we have 3, 4, 5-year-old kids that have these deformities that nobody has known what to do with. And so that's where our mission comes, because we see a lot. Pseudoarthrosis of the tibia. We see congenital clubfoot and lobster claw. So the amount of deformity that we see, I think, is mostly just because prenatal diagnosis and not early treatment. So then we see it a little bit later. So that's the biggest difference between here and in my practice, because my practice is mostly kind of residual stuff because they've already had surgery.
Thank you. I understand it. So I just wanted to ask, what does the future hold for healing the children in NOH?
I look at this as kind of the history of healing the children and the history of NOH is kind of meshed. We have developed, over the past 16 years that I've been coming, 10 mission trips, amazing relationships, and not just coming and doing surgery, but teaching all the medical officers that we've had throughout the years more and more advanced techniques of foot and ankle surgery and pediatric orthopedics. So I look at this as a mini fellowship for the staff, the people who are lucky enough to come work really early and stay really late. Thank you very much. But I think above and beyond is the relationship factor, and I see this going into the future past the 30 years of the hospital and really becoming an integral part of each other's lives, because with the internet and with technology now, we can really stay up with the with the follow-ups. So if there's a problem with the frame or something's going on, we are literally a second away on WhatsApp or Facebook chats. So we can really kind of help affect and help manage, which then teaches the medical officers more about how to manage stuff. So I consider this a mentorship fellowship, that we get to do some surgery, but the biggest thing is the relationship, all the medical officers that we've trained, having us as mentors and you as teaching us how to do surgery with certain things that we may not have. So that's really where we see it. I think it's a melding of the cultures in the best possible way.